Greetings, I'm Dr. Farzana Haratian, a psychologist in supervised practice at CPABO in Ontario under the expert supervision of Dr. Wendy Ledoux and Dr. Bahirai. And today I'm going to talk about professional misconduct as a series of talks we have on the topic of ethics and ethical consideration. A professional misconduct comes from Schedule 2 of the Regulated Health Professions Act, the RHPA. And what is professional misconduct? I shall say that the college's discipline committee can revoke or suspend your license, impose conditions, or fine you under specific circumstances. Category 1 is abusive conduct. Sexual abuse of a patient, physical abuse or verbal abuse. Sexual abuse includes intercourse, touching, or sexual remarks. Category 2 is boundary violations, sexual improper behavior like dating a patient, financial exploitation like borrowing money from a patient, and dual relationships that impair judgment or exploit. Category 3 is practice, standards violations. Failing to maintain standards of practice, practicing outside your scope or competence, delegating to unqualified people, falsifying records, or failing to keep records at all. Category 4 is professionalism. Contravening the act, breaking the RHPA or Psychology Act. 1. 2. Conduct unbecoming a psychologist. 3. Failing to cooperate with the college in an investigation, and failing to report another member's sexual abuse. Now, what do we mean by sexual abuse? It is the most serious, absolute prohibition with current patients. With former patients, the burden is on you to prove no exploitation, and the college presumes sexual involvement within 1 year of termination is abuse. Falsifying records, backdating notes, making up information, signing for work you didn't do, this is misconduct every time. Failing to keep records, no notes, incomplete notes, illegible notes, and practicing outside competence, doing therapy or assessment you are not trained for. And bartering, trading services for goods is strongly discouraged, usually considered exploitative, so avoid it. Disclosing confidential information without consent or legal mandate, failing to obtain informed consent, abandoning a client, ending services without notice or referral, discriminating in service provision based on protected grounds, and failing to report another member's sexual abuse, failing to cooperate with college investigation. What happens if you commit misconduct? The discipline committee can revoke your certificate of registration, suspend it for a period, impose conditions or limitations, impose a fine, require you to take education, or reprimand you publicly. Your name goes on the public register with the finding. Remember that the college's mandate is public protection, not helping psychologists. Their job is to investigate complaints and discipline members. Your job is to cooperate. If you receive a complaint letter, do not ignore it. Failing to cooperate is itself misconduct. Respond promptly, seek legal advice if needed, but do not delay. Is it misconduct to have a consensual relationship with a former client? Possibly. The code says it is likely unethical and requires you to prove no exploitation.